The diseases and conditions of the reproductive system. Syphilis. Being relatively rare, with fewer than 20,000 US cases annually, syphilis is a bacterial infection that is normally spread through sexual intercourse. There are 3 stages of syphilis. Stage 1 is identifiable by a sore on the mouth, genitals, or rectum. Stage 2 is characterized by a bodily rash that, without treatment, goes on to Stage 3. Stage 3 results in brain and nerve damage as well as heart and eye damage, which can lead to permanent blindness if not treated. Stage 3 will occur up to 30 years after infection and can eventually result in death. Possible symptoms include painless ulcers, sores, vaginal discharge, genital warts, rashes, itching, and inflammation of the rectal lining. Syphilis is treatable with penicillin. Prescriptions include antibiotics such as Zithromax. Chlamydia, a common STD that can easily be cured. It is commonly known as the clap. You can get chlamydia by having vaginal, anal, or oral sex with a partner who has chlamydia. If left untreated, some patients may not experience any symptoms, yet there are still some patients that experience painful urination, discharge, pain during intercourse, spotty bleeding, and pain in the pelvis. Chlamydia can cause permanent damage to a woman's reproductive system and restrict the ability of pregnancy, since it will spread to the fallopian tubes, eventually causing pelvic inflammatory disease. Chlamydia is treatable through antibiotics such as Zithromax, Biaxin, or Cipro. Pelvic inflammatory disease. It is an infection of the woman's reproductive organs as a result of untreated STDs, specifically chlamydia or gonorrhea. Symptoms are mild and include fever, pain in the lower abdomen, discharge, odor, pain or bleeding during intercourse, and bleeding between periods. Pelvic inflammatory disease can be cured through the use of antibiotics. If not treated, scar tissue will form outside of the fallopian tubes, long-term pelvic pain will occur, and women will lose the ability to get pregnant. Gonorrhea. Gonorrhea is caused by a bacterial infection that not only affects the reproductive system, but can also affect the mucous membranes of the mouth, throat, eyes, and rectum. The infection is transmitted through sexual contact with an infected person involving the penis, vagina, anus, or mouth. Note that men do not need to ejaculate to transmit or acquire gonorrhea. Gonorrhea is characterized by fever, arthritis, and dermatitis. Other symptoms include anal discharge and pain between bowel movements, red, swollen, warm, painful joints, eye pain, and this is common in both genders. In males, the testes and scrotum experience pain, and in women, they experience painful intercourse. Those infected with gonorrhea are also at a higher risk of contracting HIV, or if HIV positive, spreading HIV in addition to gonorrhea. Testing for gonorrhea can be completed by analyzing a urine sample or swab of the affected area. If testing is positive for gonorrhea infection, you and your partner will need to undergo treatment with certain antibiotics to treat the infection. Genital herpes. It is caused by a virus, and there are 2 types of the herpes virus. Type 1 and Type 2 both cause cold sores around both the mouth and genitals. Most transmissions occur from oral, vaginal, or anal sexual contact with someone who carries the virus. Due to its viral nature, no particular symptoms can occur. However, it can be noticed when you feel run down like the flu. Cold sores often start as a tingling or burning sensation on the genitals or anal area. Even though infection has occurred, symptoms may not show due to the virus not being active in your system. Genital herpes can't be cured, but treatment such as antiviral drugs, which may reduce the severity of symptoms, can help. Antiviral drugs include Zovrax, Famvir, and Valtrex. Benign prostatic hyperplasia. It is an enlargement of the prostate, The prostate experiences two main growth phases. The first at puberty, and the second growth period begins around the age 25 and continues during a man's life. BPH often occurs during the second growth phase, where the prostate enlarges to where it squeezes the urethra. About half of all men ages 51 to 60 have BPH, and over 80% of men over 80 have it. In BPH, the bladder walls become thicker, eventually reaching the point to where the bladder loses its ability to empty completely. BPH is benign, meaning that it is not a cancer. However, BPH and prostate cancer can occur at the same time. Symptoms of BPH include feeling that the bladder is full even after urinating, feeling that urination can't wait, weak urine flow, dribbling of urine, the need to stop and start urinating several times, trouble starting to urinate, or even the need to strain during urination. There is no cure for BPH, however treatment does exist. Treatment focuses on reducing symptoms including lifestyle changes, medication, or surgery depending on the severity of the symptoms. Medications include Hytrin, Avodart, and Proscar. Endometriosis. It is a condition where the uterine lining, endometrium, grows outside of the uterus. This can involve the ovaries, bowel, lining tissue from the pelvis, but rarely involves other tissues beyond the pelvic region. The displaced uterine tissue functions normally, but the tissue has no way to exit the body, becoming trapped. In cases where the ovaries are involved, endometrioma cysts can form. This condition causes pain, especially during the menstruation cycle, and causes fertility issues. Approximately 6.3 million women in the US are affected by endometriosis. Endometriosis is caused by the internal bleeding during the menstrual cycle where blood cannot leave through the vagina, and the breaking down of blood tissues from lesions cause inflammation, pain, and possibly infertility, as well as scar tissues and bowel problems. Symptoms include pain during intercourse, infertility, fatigue, painful urination during periods, and gastrointestinal upsets. Endometriosis is not contagious. It takes around 10 years from the onset of symptoms for proper diagnosis. There is yet no test for endometriosis. The only way to confirm that you have endometriosis is to undergo a diagnostic laparoscopy with pathology confirmation of biopsy specimens. The best treatment for endometriosis currently is a laparoscopic excision surgery, ablation, and cauterization. Laparoscopic excision surgery is the removal of the lesion wherever it grows. Options for symptom management include low-dose oral contraceptives, intrauteral devices, and painkillers, as well as GnRH therapies such as Lupron 3. Toxic shock syndrome. It is a rare and life-threatening illness that is caused by bacterial infections, often caused by Staphylococcus aureus, but can also be caused by Streptococcus bacteria. Historically, toxic shock syndrome has been contracted by the use of superabsorbent tampons, and currently manufacturers have taken steps to reduce the risk. Toxic shock can affect men, children, and postmenopausal women. It is not limited to tampon use and can result from skin wounds and surgery. Symptoms include sudden high fever, hypotension, vomiting, diarrhea, rash that is sunburn-like, especially on the palms of your hands and soles of your feet, confusion, muscle ache, redness of the eyes, mouth, and throat, seizures, headaches. Risk factors include cuts or burns on skin, recent surgery, contraceptive sponges or diaphragms or other superabsorbent tampons, and viral infection. Toxic shock syndrome causes shock, renal failure, and death. There is no specific test for toxic shock. Patients will likely provide a blood and urine sample from their vagina, cervix, or throat. Patients may also receive a CT scan, lumbar puncture, or chest X-ray to the affected organs. Current treatment includes hospitalization, antibiotics, blood pressure stabilization medication, and other supportive cares for other side effects. Ovarian cysts. They are fluid-filled sacs or pockets within or on the surface of the ovaries. Many women have had ovarian cysts at some point during their lives. Most ovarian cysts present little or no discomfort and are harmless. The majority of cysts disappear without treatment within a few months. However, ovarian cysts, especially ruptured ones, can produce serious symptoms. Symptoms include pelvic pain, a dull ache that may radiate from your lower back and thighs, pain during bowel movements that feels like pressure on your bowels, nausea, vomiting, or breast tenderness that is experienced during pregnancy, fullness or heaviness of the abdomen, or pressure on your bladder that causes you to urinate more frequently, or having difficulty emptying your bladder completely. Causes. Most cysts develop as part of the normal functions of the menstrual cycle. These cysts are known as functional cysts. Ovarian cysts can be detected by a pelvic examination or pelvic ultrasound. Fluid-filled cysts are unlikely to be cancerous. Those that are solid or mixed in composition require further analysis for cancer detection. For treatment, your doctor may suggest watchful waiting, birth control pills, or surgery to remove the ovarian cyst. Orchitis. It is the inflammation of one or both of the testes, usually caused by a bacterial infection or the mumps virus. Bacterial orchitis is caused by bacteria such as Chlamydia and Gonorrhea through sexual transmission. Viral orchitis is caused by the mumps virus. There are other viruses that may cause orchitis, however, they are much rarer. Symptoms of orchitis tend to come on all of a sudden and may include swelling of one or both of the testes, moderate to severe testicular pain, testicular tenderness, low-grade fever, nausea with vomiting. In some cases, pain is felt in the groin as well. Diagnosis. Cultures can be made from the urethral discharge and will look for gonorrhea and chlamydia bacteria. Urinalysis, blood flow monitoring using ultrasound, and nuclear study of the testes are other ways to diagnose orchitis. For treating bacterial orchitis, antibiotics are usually prescribed. For viral orchitis, treatments are aimed at symptom relief.